Now let's talk about the horizontal axis and appendices. The horizontal axis consists of the right and left ethmoidal labyrinths. Remember, this is the anterior view. The labyrinths are the two lateral wings of the ethmoid bone. They are the two bony lattice networks that hang from the edges of the cribriform plate. The labyrinths house the ethmoid air cells and all of the structures enlisted. So they house this very long list: the ethmoid air cells, as mentioned already, the lateral nasal wall, the nasal conchae, the superior nasal meatus, the sphenoethmoidal recess, the middle nasal meatus, the ethmoidal bullae, the semilunar hiatus, the uncinate process, and the orbital plate of the ethmoid bone. So we'll be going over all of these structures. So let's talk about the ethmoidal air cells. The ethmoidal air cells consist of small invaginations of the mucous membrane of the middle and superior nasal meatuses into the ethmoid bone between the nasal cavity and the orbit. Let's discuss the lateral nasal wall. The lateral nasal wall consists of the medial surface of the right and left labyrinths of the ethmoid bone. Here we can see the bony surface of the lateral nasal cavity. This appears as a thin lamella that descends from the inferior surface of the cribriform plate and ends as the middle nasal concha. So as you can see in the diagram here, the inferior nasal concha is a totally separate bone. Superiorly, the surface contains numerous vertical grooves formed by bundles of olfactory nerves. So all of these grooves here. These grooves mark the olfactory nerves. Superior and middle nasal conchae hang out from it on the medial side. So here is the superior nasal concha, and here is the middle nasal concha. Each concha creates a small thin space under it called a meatus. So this space here, right under the concha, right here, these are called meatuses. Sometimes we can see another structure here called a higher nasal concha. That's very rare. So now let's talk about the nasal conchae. So the nasal conchae are also called turbinates. These are thin, curved, bony projections directed downwards and medially like curtains hanging from the lateral wall. In humans, they are much simpler and plate-like. So now we're talking about the superior nasal meatus. It is the narrow passage located between the superior and middle nasal conchae. So this passage here is what we're looking at. The posterior ethmoidal sinus opens into it by one or more orifices. So here's one orifice. Here's another one. So as I explained earlier, sometimes we may have another structure called the highest nasal concha, attached right above the superior nasal concha, just before the sphenoethmoidal recess. We'll talk about the sphenoethmoidal recess as well. This also may cover an opening to the posterior ethmoidal air cells. So the sphenoethmoidal recess. This structure lies supra-posterior to the superior nasal conchae. It's right over here. It receives the opening of the sphenoidal air sinus, which is an air-filled cavity in the sphenoidal body. So this is the sphenoidal air sinus. So now let's go over the middle nasal meatus. The middle nasal meatus is longer and deeper than the superior one. The anterosuperior part of this passage leads into a funnel-shaped opening, the ethmoidal infundibulum. right over here, through which it communicates with the frontal sinus. So this structure leads the opening to the frontal air sinus. We'll see more of that when we discuss the ethmoidal air cells. It also covers the uncinate process and the ethmoidal bullae. So here is the uncinate process. You can see a better view of it right over here. And this is the ethmoidal bullae. The semilunar hiatus is a deep and semicircular sulcus below the bulla. So this thing right here. The opening of the maxillary air sinus is located in the posterior part of the hiatus. All right, here we have the semilunar hiatus. The semilunar hiatus is also known as the hiatus semilunaris in Latin. It is a crescent-shaped groove in the lateral wall of the nasal cavity just inferior to the ethmoidal bullae. So here we have the ethmoidal bulla, and this is the uncinate process. The space in between over here, this is referred to as the semilunar hiatus. It is the location for the opening of the maxillary air sinus. Now let's discuss the boundaries of the semilunar hiatus. Anteroinferiorly, we have the uncinate process. Superiorly, we have the ethmoidal bullae. And posteriorly, we have the middle nasal concha. So now we're talking about the uncinate process. It is a thin, leaf-shaped, curved process, variable in size, projecting posterior-inferiorly from the labyrinth. The upper edge is a boundary of the hiatus semilunaris. It serves as the antero-inferior border of the hiatus semilunaris. It also appears in the medial wall of the maxillary sinus as it crosses to join the ethmoidal process of the inferior nasal concha. So now let's look at this. We're discussing now the ethmoidal air cells. The ethmoidal air cells consist of small invaginations of the mucous membrane of the middle and superior nasal meatuses into the ethmoid bone between the nasal cavity and the orbit. Generally, the air cells are divided into three groups: the anterior, the middle, and the posterior. These are the frontal sinuses. These are the sphenoidal sinuses. And this is the maxillary sinus. So the anterior ethmoidal air cells, on average, they contain 11 cells. Their orifice opens directly into the middle nasal meatus via the ethmoidal infundibulum. The middle group contains 1 to 7 cells. They open directly into the middle meatus and are sometimes called bullar cells, as they form the ethmoidal bullae. You look carefully. This here is the ethmoidal bulla. The posterior group also contains 1 to 7 cells. They open directly into the superior nasal meatus. Now, when we look at the unarticulated bone, it displays open air cells. So all of these air cells, you could say their mouths are open. There's nothing covering them. But in the articulated skull, the cells are covered by the adjoining bones. So the anterior surface articulates with the frontal process of the maxilla. So the ethmoid plate of the medial orbital wall articulates with the frontal bone superiorly, the lacrimal bone anteriorly, the maxillary bone inferiorly and anteriorly, the palatine bone postero-inferiorly, and the sphenoid bone posteriorly. There is also these two foramina on the frontoethmoidal suture at the junction and roof of the medial wall. The anterior foramen is called the anterior ethmoidal foramen. It transmits the anterior ethmoidal vessels and nerve. The posterior foramen is called the posterior ethmoidal foramen, and it transmits the posterior ethmoidal vessels and nerve.